Hi, everyone. My name's Daniel Williams, Senior Editor at MGMA, and welcome to today's webinar. Today's webinar is How to Run Smarter and Trusted Operations by Balancing AI and Human Talent. We would like to thank Edge for their sponsorship. Visit their website at ownedge.co. That's ONEDGE.co. And that's where you can learn how they're combining remote work with the operational efficiency of AI to deliver front and back office support for healthcare practices, helping teams work smarter, scale faster, and focus more time on patient care. Please see the slide now for available credits for the live and on-demand experiences. To claim all credit types, you must complete the session evaluation following the webinar. Now, we do highly encourage interactivity in our digital events, so please use the chat button to talk to your fellow attendees and the Q&A button to submit questions for the presenters. Any additional resources can be found in the Learning Management System. You can also access these during the webinar by clicking on the Resources button in this Zoom room. The education for this session will now begin. In today's webinar, Rian Javid and Umar Tahir will discuss how AI is reshaping healthcare operations and ways to integrate AI tools into your workflows without sacrificing trust, empathy, and personalized care. Rian, Umar, I know you both have a lot of great information to share, so I'll turn it over to y'all now.
Great. Thank you, Daniel, for the warm introduction. So thanks everyone for joining. Looks like we got a great turnout, over 100 people. So I just wanted to introduce myself. So I'm Rehan Javed. I'm one of the co-founders of both Edge, which I think we mentioned, and also Renova AI, which is our AI wing. I'm also medical director, chief medical officer at one of the Common Spirit Dignity Health hospitals in California. Um, I've been doing that for about a year, been a practicing psychiatrist for about 6 years, and before that, I was an attorney.
All right, thanks, Ron, for that. Hi, everyone. Nice to be here. So I'm Umar Tahir. I'm actually a physician myself. I'm also the Chief Operating Officer for Nova AI, which is, like Ron mentioned, the sister company of Edge. We do a bunch of AI revenue cycle management. And yeah, I've been involved in just the virtual staffing world as well as the AI billing side of things for quite a bit now. So luckily, I am now in a place where I can just kind of talk us through this. All right, so I think we can just go ahead and get started. Let's first walk through some learning objectives over here. So we've divided these into three categories. The first thing we're going to do is we're just going to analyze the appropriate roles, limitations, and integration points of AI within healthcare operations. So we're pretty much just figuring out what is the most efficient way to use AI in healthcare, what its limitations are, or pretty much areas where there's still very much a need for humans to be there. And then lastly, integration points of AI within healthcare. So where exactly in healthcare should we be relying on AI, and where exactly we should definitely still be using the human side of things. The second thing, of course, would be to evaluate strategies to incorporate AI while preserving empathy, trust, and patient-centered care. So one major concern that we do just see whenever the conversation of AI comes up is everything still to a degree feels too robotic. So we do still want to maintain that aspect of human empathy through patient-centered care, which is the entire point of all of this. And then the last thing we will talk about is design optimized workflows that combine AI-driven efficiencies with remote and in-person human talent. So AI is just one part of this presentation. The other part is, of course, going to be virtual staffing, remote talent. The goal here is that when you walk away from this webinar, we do just want you to take home some lessons on just how exactly you can combine both AI and remote work to maximize the efficiency of your practice. So moving on, before we really get into the nitty-gritty details, let's walk through some of the background here because it is quite a bit of an interesting story. So funnily enough, people think that AI kind of just took over the tech industry, the medical industry, and even all of our lives pretty much overnight, but that's actually not the case. So an interesting example here is that one of the very first softwares, which actually dates all the way back to the early 1970s, was a system called Mycin, which was developed at Stanford University. And Mycin, it was pretty much this computer program, which was designed to help doctors figure out which bacterial infections a patient might have, things like, meningitis, severe bloodstream infections. And it would just recommend the right antibiotics and also adjust their dosage based on the patient's weight. So it was never really used in real hospitals because of the technology limitations of the time. However, here's the interesting bit. When they tested it later, when some advances were made, they actually figured out that Mycin's recommendations were about as accurate as infectious disease specialists at Stanford. So this is what's remembered as the first clear sign that computers with context and therefore artificial intelligence could just help doctors make better medical decisions. Moving on to the early 2000s, that's, I would say, what was really the pivotal turning point for AI use. And that, of course, began with the widespread adoption of EHRs and the digitization of healthcare data. So around the mid 2010s here, so I will be, by the way, just dropping a lot of numbers here. If anyone wants some references to these, feel free to drop me an email after this webinar. I'd be more than happy to share them over there. But around mid 2010s in the US alone, about 80% of hospitals had already adopted some form of EHR, moving past the older system of just paper records. And then this massive volume of just structured and unstructured data, all the way from stuff like lab values for diagnosis, treatment planning, and even operational improvements, this is really what allowed the training that the AI needed to just become the behemoth it is today in healthcare to take place. Just expanding on that, it's pretty much what led to a major spike in machine learning applications across healthcare. And while the numbers globally, they're not really that consolidated, some studies have just shown that there's been a major spike in machine learning research in healthcare in particular from 1994 all the way through to 2023. For example, even right now, in August 2025, the FDA has approved about 692 AI or machine learning enabled medical devices already. Most of them are intended for radiology, but there's also a lot of them being used for cardiology, both of the specialties, which are, of course, the biggest, I would say, growing subsets for AI implementation. Just expanding a little bit on the radiology side, AI adoption in medical imaging is actually the one area where AI has surged the fastest compared to pretty much everything else out there. For example, in 2018, only 17%, I believe, of healthcare organizations were using AI tools for imaging, but in 2024, that numbers rose all the way up to over 50%, which has pretty much more than double the value in just 6 years. And then in the US alone, the AI in medical imaging market, it was estimated at $524 million in 2024. And the projected growth here is actually all the way up to $2.9 billion in 2030. Radiology, like I mentioned, it is leading the way here. About over 340 AI tools, they have gained FDA clearance, and about 2/3 of the US radiology departments right now are actually using AI, which is a pretty crazy number to think about. So moving on to the next one, just kind of want to walk through some modern advances here. So the role of AI is expanded pretty dramatically. That much we have seen, not just in the healthcare industry, but pretty much in our daily lives, the tech industry, all over the place. So even though a few years back it did kind of feel a little gimmicky, I would say, today it's no longer a niche or experimental technology. It's pretty much woven into the fabric of healthcare. So for example, I have some more numbers over here. So this one study done by Microsoft in March of 2024, it found that 79% of healthcare organizations are now using AI. And the return of investment they're seeing on that is about $3.2 for every $1 invested. And this was realized in only 14 months. And I think this is pretty surprising because, you do believe that the future is AI. You kind of see it just all over the place, but seeing that number, 79% of them already using it just from this March 2024 study, that's a pretty high spike. And then physicians, they are just increasingly integrating AI. This other report we ran through, it kind of saw that 66% were reporting using AI in healthcare in 2024, which is all the way up from just 38% in 2023. So again, massive spike over there. There's some other specific use cases as well. There's just 3 examples we can talk about right now, but then the rest Rehan will just walk us through. So for example, AI is being used a lot in predictive analytics. So it's helping providers anticipate clinical risks, all the way from mainly involved in early detection of patient deterioration to precision in surgical planning. Predictive models are just delivering smarter and more data-informed care. And then this was a fun one, but even robotic surgery feels very, sci-fi, but at the same time, AI has been making a lot of enhancements there as well. There's one data point I have here. It does say that AI-assisted robotic procedures have achieved 25% shorter operative times and 30% fewer intraoperative complications compared to manual techniques. So not only is it enhancing the robotic surgery industry, it's leading to just better patient care in general as well. And then moving on to administrative automation, even on the operations side, there's firms out there like Omega Healthcare Management, which have just adopted AI to process over 100 million transactions since 2020 already. And that's for about 60 to 70% of all of their clients. This has pretty much saved about 15,000 employee hours per month. It's half the turnaround time. It's cut documentation time by 40%. And the best part, it's achieved all of this while maintaining a 99.5% accuracy. So, pretty advanced stuff all around. Some other big use cases, which we will kind of walk through the rest of this presentation, so the biggest one I feel like is just medical coding and billing. So already in 2023, the AI in medical coding market, it was valued at $2.4 billion already. And the projections, they're seeing that it's going to go all the way up to about $3.1 billion in 2032. But then that's just the coding side. If you look at the billing side, in 2025, the market was estimated at 4.49 billion already a couple months back. And the growth here is actually expected to go all the way up to $12.65 billion by 2030. So there's other projections here as well that are just showing us that it's going to be even higher of a number, but it kind of just delivers this message that, hey, you know what? AI is here. It's already started just taking over a lot of healthcare and just delivering some very net positive results already. So if there ever was a time to just hop on the train and start implementing in your practices, the numbers are just showing that it definitely is right now. Just one thing that you do want to be wary about before I hand this over to Rehan is the regulatory frameworks in place for AI at the moment. So one example I can provide to you for this is, so let's say your practice requires a CPT license from AMA. So back when AI was just starting to come on, AMA was just handing out CPT licenses pretty openly, but recently, for example, they have just started modifying the frameworks in place that if your practice or if your even company, they do require a CPT license and the use of AI is involved. In that case, they are just holding back for now. They do want to just revise their guidelines, stuff like that. So it's definitely a work in progress as far as regulation is concerned. However, considering all the numbers I shared and considering just how much AI has grown in just these past few years, it's pretty much set in stone that the future will have a major proponent of AI in it, and the regulatory framework will eventually work out. And that's pretty much, I guess, what I want to talk about as far as the history and modern advances are concerned. Rehan, if you just want to go ahead and get to the actual main talking points.
Yeah, great. Thanks so much for the introduction and the background on that. Yeah, so I think, just touching base on that, I think, as we all know, AI is, very new in terms of like everyday practices, but it has been around a long time in different aspects, much slower than it is now. And I think over the next few years, obviously, we're going to see pretty dramatic increases in the adoption of AI. However, with that said, I think probably almost everyone here realizes that humans are irreplaceable, right? We're working with humans. I'm a psychiatrist. I deal with people every day, and there's a lot of frustrations with whether it's technology and other stuff, especially in the medical field, but also in the customer experience field, which customer service, which to a large extent is the medical field. So I think there's a few things where, just wanted to touch on where humans are irreplaceable, and a lot of that is that face-to-face communications, right? So the empathetic communications. I don't know how many times I've been on hold with like Verizon or T-Mobile or whatever, or my health practice. Where I use Kaiser here in California, and just sometimes to get through to a person is very, very frustrating. And if you have a patient who's trying to get through, whether it's like a very small billing question or a larger one, and all they are getting through to is a bot or an agent, that can be very, very frustrating. And I think if we want to keep our patient satisfaction high, and make them feel that they are being heard and listened to, that's something really we got to find the right balance. So, is there a place for an AI agent or bot in the call tree? Yes, there is, but we just can't be like making it impossible to get through a human. Um, the other areas where we think that humans are replaceable is that value based. So the third point, care decisions that require varying quality and cost. So I do get a lot of end of life decisions as a psychiatrist. I also get whether people should be on a psychiatric hold, whether they should have the independence to leave, whether they should be taking medications. And so, we do have AI applications where they can judge based on, are you taking your medications, how many times you've been in the hospital before and stuff like that. But really to leave someone's freedom or, certain end of life or forced medication decisions to an AI, at least at this point, is probably very premature. And, it doesn't really seem like any time in the future that will be something that we'd want to leave to AI. The other thing where AI does have a lot of limitations are the rare conditions and gray area for documentation. Sometimes a lot of times AI can lead us to these rare conditions, especially if if the doctor is not a specialist and not really thinking about that. It could get us the labs, the results, and stuff like that. It can point us. But in terms of the documentation and the gray area, um, is still very limited. However, so where the next point where AI does excel is transcribing, very routine rote stuff that, a lot of people aren't happy to do, but, very, very necessary, right? So some of that including like AI scribes. There's, probably at this point, there's 100 different companies. I think yesterday or the day before, Epic just came out and they announced that they have their own AI scribing program. Um, Summarizing clinical notes, AI is really great. So I think, some of the things that I use in my own practice is where I pull up a patient chart and there's already a summary of the last like 5 or 10 different visits that the patient came in for this. This is a summary of the treatment and this is where he is now. This is, where we're going towards the future. So that's one area. I think some of that is limited. A lot of these AI companies, especially for scribing, they don't integrate fully into the EHRs. That it does become very complex. It's a time consuming process. Excuse me. And part of that is you have to get permission from the EHRs, you have to get permission from the medical groups, and just to get all of that can be very cost prohibitive for a lot of EHRs or a lot of AI companies, and they don't end up doing that. So it's just very basic, like the doctor's talking to the patient, they summarize that, and that's about it. They won't get the back and forth. Um, the other area where we've seen significant adoption of AI is the medical coding industry. So both coding and billing. So there's some places where they'll pull the notes, but more commonly we see where the note has to be copied and pasted, put into the agent, and then the agent spits out, whatever the CPT code is, 99213, 214, and then they'll take that and then they'll put it in. And again, the more advanced agents, or not necessarily the more advanced agents, but the more comprehensive and probably the better companies will work with your EHR, integrated with the EHR where you don't have to copy and paste and submit that. But since we are still at the very early stages and it can get very expensive to integrate with the different EHRs, that's still a limitation. The other area where we're seeing AI in the next probably like 6 months to 2 years is on the billing submission part. So I don't know how many people here are on the billing side are very familiar. So a lot of times, billing companies, they'll take the person's name, medical record number, address, and probably like 10, 20 other features, and they're just copying and pasting it over to the billing solution from the EHR. Obviously not very efficient. Talking to billing companies, if they have people in India, Pakistan, Philippines, or the US, they're looking at probably maybe 100 submissions a day, and that's a lot of that's because you're just like copying and pasting all these tasks over and over and over again. Whereas a human can do 100 in a day, the AI can do 100 in like 30 seconds, right? Maybe a minute at the most. And a lot of that, but to get to that point, you do have to have the EHR integration, which a lot of companies just don't have at this point. And we don't really see most companies getting that in the next, 6 to 12 months. That's probably more of a longer term frame work. The other thing is task automation via AI agents. So like, very, very simple stuff that we're doing on there. Um, think of this as like supercharged bots, right? So unlike traditional automation, which just follows a fixed script, AI agents can understand what they're doing. For example, they can log into an EHR, navigate to the correct patient file, update demographics, check lab results, and flag for anomalies. And then they'll take those anomalies and they'll send it to the provider, and they might even flag the scheduling team. Can we schedule this person? There's something concerning here, and they might even send a message to the patient that please call your doctor. We've been trying to reach you, or we've reached you and left a message. You didn't respond. Can you please reach us? So that we're able to do that. Some of this stuff is already being done. So I don't know how many people use, there's some prescription databases in other countries. So if you're using like Epic or Cerner, you can just click on, in California, it's called Cures. In Florida, there's a different term. Every state has their own database. And so a lot of times you can just click on that. And we call them, we've traditionally called them macros. With the macros, is maybe like one or two different things. With the AI agents, we can train them to do 5, 10, 20, 30, 50 different things. And there's really no limit. But again, each practice has their own workflow. And so the agents do need to be trained to each different workflow for the automation. So basically, I think in a lot of ways, it's not just one macro, it's maybe like 100, 200, 300 macros, depending on the program. The other thing that we're really looking at that we've seen, I think that's pretty successful, I think in addition to the medical coding and the billing, is insurance verification. So there's different insurance portals that we have out there. A lot of times, probably I think it's about like 80% of maybe 90% of the insurance information you can get from either the portals or the EHR. And these agents, they can go in there, get all the information, get your copay, um, get your deductible. Does this patient have an outstanding bill? And we're able to print that out or not print it out, but like we can put it in an Excel sheet so that when your front office team and your billing team comes, they can see everyone. They can flag, oh, this person owes $200. This person hasn't paid in 3 months. So when they do come, your team can go there and be like, oh, are you having financial difficulties? Is there any way we can create a payment plan? How can we help you out? We don't want to use this to punish patients, but when we realize there's patients who are having problems, especially certain areas, I think maybe the economy is greater, some places not so great. Maybe people lose jobs, and those are things that we can look at beforehand and try to tailor a plan for them before the day even begins, so that when they do come, your front office staff is not overwhelmed. They know what's going on, and that you have a plan before that. It also saves a lot of time. So if you have 30, 40, 100, 200, 300 patients, to have someone do that manually, um, it's going to take all day, right? So you might have like a team of 3 or 4 people if you have 20 doctors to do that. Just not reasonable, I think, in this time and place, especially with minimum wage in places like California going up to $25 an hour for healthcare employees. We already talked about payment posting, claims matching. Um, just submitting that can take a long time, but a lot of the AI stuff can also end up, you still have rejections, right? For whatever reason. And the AI over time can learn the reasons for the rejections and can also respond to those. But again, that's a little bit more complex, where the agent has to be integrated both into the EHR as well as the billing solution, which can take some time and it can be a little bit of a problem. Um, at the very beginning, we talked about call screening and automation. Again, the very beginning of the reception system is okay. But once you get past, if a patient really wants to talk to someone, that's an issue. You don't want to make it too hard to get through to someone. So there's already a lot of companies like one of our friends, Luma Health, Luma Health. They've been doing text-based and computer-based scheduling and what have you. And so this is just another level on top of what we've probably been doing for the last like 10 or 15 years. A lot more accurate, a lot simpler, a lot quicker, a lot more efficient on that. So Yeah, so yeah, these are some of the areas where AI excels, and then some of the areas where we think humans are irreplaceable. Okay, so going to the next slide, enhancing operational efficiency. So we kind of talked about this stuff. So where can right now today, still very early, obviously in the AI world, but where can we make AI more efficient within a short period of time, which is 3, 6, 12 months? A few places where we've seen the real world impact of AI. The one I think everyone's probably most familiar with is scribing. I mean, there's a bridge now. Epic has a system. There's probably 100 different AI scribing programs out there. There's very low barrier to entry, so you have to really make sure that this one's better than the other one, or I think more frequently what a lot of my friends who are doctors or a lot of our customers say is which one's the best for us. So maybe a bridge is the best overall, but which one's the best for endocrinology? Which one's the best for internal medicine? Which one's the best for psychiatry and what have you? And so you got to really, really go on that. Um, a lot of companies they chose to do the scribing route, but we feel because the barrier to entry is so low in the future, probably the next maybe like 1 to 3 years you're going to start seeing a lot of these companies just give away the scribing software, especially some of these revenue cycle management companies. That, hey, if you do all our revenue cycle, you're billing through us, we'll just throw in the scribing solution with you. Um, and there's a couple different reasons for that. One is, as I mentioned, the barrier to entry is really low. And also if you have a really good revenue cycle software product, it's already integrating into your EHR. It already has a read and write capabilities, and so it's not like one of those where it's an add-on, um, and takes notes. It does it in like a Word document or like a little browser add-on. Then you take it and you copy and paste to that. If you already have a good revenue cycle, you already read and write, so it's already putting it in there in the note rather than putting it on the side. So that's not doesn't take a lot more effort, and the return on the revenue cycle management would make scribing easy and worthwhile to just give it away either for free or 49 or $99 a month. And I think that's really where the future is going for the scribing companies. Another thing I mentioned earlier is scheduling. So Luma Health, some of these other companies, I don't know if you guys have been to MGMA, there's like a million booths for companies that have been doing stuff like that, follow-ups, um, scheduling missed appointments, someone cancels, let's get someone else in. AI just turbocharge that. And so we've seen practices where with the text-based uh, services for scheduling, you can get the no-show rate, especially in like FQHCs and community health centers, from about 30% to maybe about 10%, and maybe 12%. So we're seeing that 10 to 12% go down to maybe like 6 to 8%. So you're seeing some marginal improvement on the edges with the AI. But I think the software was already pretty good and it was getting a lot of people, and so now it's just making it more and more efficient with the AI rather than totally revolutionizing everything. Um, and for our doctors, we're and our patients, what we've seen is, especially the AI programs are integrated with Epic, Cerner, eClinicalWorks, or what have you. They're able to get urgent labs flagged sooner and faster. So I know, when I log into Cerner for whatever, like an Epic for the last like whatever 10, 12 years, um, I'm already seeing um, flagged results, abnormal lab results, what have you. But with the AI, it's able to pull that, also compare to previous lab results, see what the trend is. Is this abnormal? Is this normal? And then also compare it to previous notes, documentation by the doctors, and then it can send a short 3 or 4 sentence blurb to the doctor. Um, and then if it's very severe, it can also send alerts to the scheduling department, to other different areas of the practice. And then obviously, as we mentioned before, can also send it to the patient to call and schedule an appointment. So I think that's very, very common. So some of the real world impacts, what we're seeing with Renova. So some of the Renova's our AI wing is what we're really seeing is for companies for that coding and billing submission time, we can reduce that by 85, 90%. So whereas it was taking all day for one person to submit 100 claims, you can do that within a few minutes. Same thing with the coding. I think one of the things that you have to be careful about is the billing's really easy to submit, but the coding very judgmental. Really depends on the documentation. Really depends on the template that the doctor's using, and so someone comes in and they're like, oh man, we're 100% or we're 90 or we're 80% efficient in coding. I think that's probably unrealistic. We have some friends who work at Coda-Matrix, which is it's a Harvard run program. They've done it software. They've had it for about I think it's about like 15 years now. And so they've really integrated AI in the last 4 years. They only have 4 different specialties, including radiology. And even with that, they feel that they can only code 31% of notes with high confidence. The rest of them they can do, but they're not quite sure if it's fully accurate. So, if you got a program that's only 31% accurate, that's in radiology and internal medicine and a couple other specialties. That's someone else comes and they're like, oh, we're like 80, 90% right off the bat. That's a problem. Um, what you can do is you can get that 30, 40% higher. One of the things that a lot of these big software companies, they do is they don't have a back end. So they don't have like, okay, so you got this 30% that's high confidence. Let's look at that other 60 or 70% and let's learn from those and feed it. So a lot of these companies, they don't do that. They just look at the really simple ones. You got the 30%, 35%. Let's just do that. That'll still save you a lot of time. But if you have the back end people who are looking at these notes that are lower or medium confidence, training the machine on that, we've seen you can get from that 30 to 40 or 30 to 50% all the way up to maybe 60 to 80%. Getting higher than that, like 75, 80% can be challenging, but if it's more of a, field where the doctors are working on really good templates, they have really good documentation, you could possibly get it a little bit higher. But you still need the humans for that other 20 to 30 or, 40%, I think, in some practices. Um, the other thing we're able to see is auto denial detection flags, claims with missing documentations, maybe labs. We're also able to run reports on, hey, your doctors are billing too many 99213s. This is what they're missing. Maybe, the patients have done their labs, they're not putting in their notes. There's no continuity of care in that. And so, we're able to run reports at the end of the month that, hey, if you can do this, this, and this, which is very simple. It might just be a template. It might just be a dot phrase that automatically populates when the person is doing the notes. We can get you another 10% 99214s or another 8% or 12% or whatever it is. And so I think, that's real world impact. That's real numbers if you can increase your billing by 10% to another higher level on that. And also, in addition to the billing, it also makes the doctor's notes more thorough so that when they're looking at it or they're looking back at it, they'll be like, okay, this is my thought process. This is what I was looking, these are the labs. And that'll save your doctors a lot of time in the future too. And on the Edge side, where we have the human, so Edge does more of the remote employees. What we're seeing with that, with our human employees, AI tools monitor agents' response times, triggers alerts if SLAs are missed, and suggests responses to common queries, right? So if you have, nurses or doctors or whoever the staff is, and they keep getting over and over the same questions, you can get really quick dot phrases. The AI can actually suggest responses to the person, it's the doctor or the front office staff, whoever it is, just looks at it very quickly and is able to get the response, whereas before it might have taken, 3 to 5 minutes to write up something, the response is already written. So it can take, maybe like 20 seconds, 30 seconds, 40 seconds. And so if you're saving 60% of the time, you can respond to more doctors, staff, nurses, everyone's less burnt out than they would be otherwise. Additionally, we can also do sentiment analysis on call logs, help supervisors spot burnout and stress early. Are the people, is the number of calls they're doing less? Are they using less words? Is it more, are they talking too much, not enough with the patient talking? And so you can run analysis on all of that. We've seen where, if the person is talking too much, the patient doesn't talk. I think that's the same thing with doctors, nurses, whoever it is. Patients just don't feel like they're being heard. And so some of that stuff can be used for training, as well as quality of care issues, right? So, so we have that. All right, on the next one. So we're gonna go over a couple of different scenarios before we open it up to different questions. So on this one, so we have a thriving 20 physician practice. It's expanding services and plans to hire 5 new doctors over the next 3 months. Right. So this expansion is very exciting, but it also presents a significant administrative challenge. The practice current back office team is already working at full capacity. So to add 5 new doctors on top of the 20 that they already have is probably not super realistic if you want to keep the quality of care going. The existing manual coding and billing process is a bottleneck, leading to slow turnaround times and a high number of claim denials. To support 5 new doctors, the practice would need to hire a substantial number of new staff for coding, billing, and administrative support, which would be a costly and time-consuming process. So as a CEO or as an administrator with 20 doctors adding 5, that's a pretty decent sized practice for outside of big hospitals or large institutions. To do that. So how would you start, right? So if I was in that situation, I'd probably want to ask my HR team, can we hire new people, right? And that's probably what most people would go to. Not always possible. They'll go on there, they'll be like, okay, we have 1 or 2 people in the pipeline, but really to support an extra 25% of people, we probably have to add 10 or 12 or 15 more people to these different areas. So instead of, just going and adding new people, I think what we see with a lot of groups is they'll go to different AI technology or technology companies and see where can you automate that, right? So the easiest part is the billing and coding. So that does take, depending on your EHR comfort level, that can take anywhere between 2 to 4 months to fully integrate and do that. You can get some benefit within like 2 to 3 weeks, but really for the full EHR integration, you're talking like a couple of months at least. So that'll, so what does that mean? So that means the billing solution can take connect to the EHR, pull the patient's note, code the note, submit it into the billing software and submit it, right? So if you're gonna have a person do that, you're probably looking at least like 5 to 10 minutes just for one claim on that. This also leads to a decrease in backlog. I mean, ideally you should have no backlog, but as we mentioned earlier, you still have anywhere between 20 to 40% of notes which are not being able to, they're not being coded with high confidence, and you still need humans to do that. So there's still going to be some of that, but instead of having your team look over the notes on the first time and try to code it, you can have a suggested code, and then it'll tell you is it low, medium, or high confidence, and then the low, medium confidence, the human can look at it. There's already a suggested code, and they can go through that. So what does this mean? This also means faster cash flow. So Medicare, Medicaid, you can get money back in 14 days instead of 21, 30 or more days, especially if the claims or denials are rejected. I think we see, from different billing companies and different practices we worked at, rejections are usually somewhere between like 10 to 15%. And a lot of those are just MRN mismatches, name mismatches, really like things that shouldn't happen, but if someone's doing 100, 120 claims a day, that some of that stuff happens, right? So this also makes it more cost efficient since your team is not doing the first round; they're able to do the higher level. They're doing like the second and third and fourth round stuff. So we've seen that from the AI. And then the second thing is, as you mentioned, there might only be like 1 or 2 different people who you're able to hire or bring on in the next, month or 2 months. And there's no guarantee that they're going to work. And we've hired 1,500 people, or we currently have 1,500 people. And we want to bring on new people, no matter how great they are in the interview, still maybe only like a 70, 80, 90% success rate. So you're still going to have maybe 1 out of 5 people who just don't work out for whatever reason. Maybe it's too far away, they don't like to pay, they're having another job, family reasons, life happens. And so we got to, um, take that into account. So what a lot of companies are doing is they're hiring remote administrative support, right? So this could be calls, scheduling, patient care coordinators, insurance coordinators, remote billing specialists. So, maybe not the first and second line, not the coding on the high confidence, but the coding on the low confidence, some of the rejections. Um, maybe some like there's always going to be some eligibility verification that you're not able to do through the software. So whether it's 10 or 20 or 25%, you still need people to do that. And then the administrative support for your doctors, for your nurses, and for your executive staff. So we feel all of those can be done by the remote staff. So maybe, instead of having to hire 15 people, you use the AI for, maybe 8 or 10 of those. You bring on 1 or 2 local people, and then you bring on 3 to 5 or 6 remote staff, which are really able to do that. So if you're looking at, as a practice, trying to bring on 15 extra people when you have 60 already, if you try to do that in like 6 months or 3 months even, that's gonna be very difficult. But if you're able to work with different teams, different vendors, and you're able to do this, your chances of success are probably going to be a lot higher. And that's what we've seen with a lot of different practices. Um, all right, so scenario 2. So very similar. I'll go through this one a little bit faster. So a busy specialty practice with an experienced in-house billing team has recently seen a sharp rise in patient volume. While this growth is great for business, it has created a mounting backlog in coding and claim submissions. The billing staff already working at full capacity is struggling to keep up, leading to slower turnaround times, increase in denials. Hiring more coders or billers will be costly, time consuming, and challenging, especially for specialty specific roles that require extensive training. Third party billing companies are an option, but their quality is also unknown. So a lot of times you bring on a third party billing, they're really great for a month, 2 months, 3 months. And then once that trial period's gone, you don't hear from them again. Um, their coding quality is not great, your rejection, denial rate, all that stuff goes up. So what do you do at that point, right? If you already have an in-house billing team, hiring a third-party billing option company might not be an option because they want to take over your entire billing process, right? So what can you do at that point? Um, we think the solution at that point is getting AI agents as opposed to like large LLMs, learning modules. So you want to use the agents which are trained to your software, whether it's Epic, Cerner, eClinicalWorks. So where they're pulling the note, they're coding it, taking all the high confidence ones, submitting it to the billing, and then you get paid, right? Then that takes a second, 2 seconds. So very, very, very minimal time, whereas for the human, it's going to take 10 minutes. So the AI will take all those high confidence, submit it, take the low and medium confidence, as we mentioned before. They'll also submit that after the humans review that. With the AI agents, we're also able to get the eligibility verifications. And then usually the third level, once once you got the coding, the billing, if you want to say that's level 1, level 2 is the eligibility verifications, level 3, you're looking at prior authorizations. And a lot of practices, doctors do that. That could be anywhere from 5 to 15 minutes. If you have to call, it can take half an hour to an hour. A lot of companies will have prior authorization specialists, including we have those. A lot of the practices we work with have those. And so with the prior authorization specialist, you're looking at anywhere from 15 to 20, 30, 40 minutes. They don't know the patient, they have to go through the chart. And so if the AI is able to go through the chart, look at all the different medications, why it's tried, why it failed, is able to put that in and submit it. It's not going to do 100%, but if you're able to do maybe like 50 to 60% of EHRs or 50 to 60% of prior authorizations without any issues, that's great. I mean, that's going to save you a ton of time, save you a ton of money. And I think more importantly for your patients, they're able to get that medication or CT scan or MRI faster rather than a week or 2 weeks or whatever the turnaround time is for your practice. And as we look below the results, so 70 to 80% reduction in human touch points per claim, faster claim turnarounds and reduced denial rates, no added headcounts or very little, or working with a remote agency such as Edge for recruitment delays, and then no recruitment delays. And then billing team is able to handle increased patient load. So say if you had 5 billers and coders, so 10 people total, 5 billers, 5 coders, all of a sudden, those 10 people can do the work of probably like 25 or 30 people. Um, the AI would help that. So maybe you can take some of those people and move them over to your front office, or they can help provide administrative support on that. So, all right. So for that one, a couple other points that we want to touch on before we go. So preserving empathy and trust in patient care. I think we've touched on this a little bit earlier. I'll go through this a little bit faster. 71% of patients say compassionate communication is more important than quick service. I think we've all seen the studies where doctors who are more compassionate, or practices that are more compassionate and the patient feels heard, they're higher satisfaction rates, less likely to be sued. And a lot of medication, or the medical field is making the patient feel heard, making sure the patient feels that they're getting the right medications, that the doctor's listening to them, that there's a follow-up and all that stuff. And so if you're not providing that, if you're not providing the empathy, no matter how great your care is, you're still going to have a large fallout at the bottom where people are not able to do that. This can add patient frustration, and it just gets, the patient just frustrated, you get low reviews, they don't work with the doctor. Um, and that's obviously not what we want, right? So AI can support the human connection, context summaries, as we mentioned, prior authorizations, billing, support all that. All right, I'm gonna go through this real quick. I know we're going a little bit long. And then so the next point where we really wanted to talk about, so remote talent, right? So if you have 20 doctors, you're trying to add another 5, 6, 7, you can add, AI can take care of a lot of it, the billing, the claims, the prior authorizations, the eligibility verifications. Um, but it can't solve your team shortage problems, especially when it comes to empathy, when it comes to talking to patients, when it comes to listening to patients. And so companies like Edge, there's a lot of different companies out there. And you really have to do your research. Are they, where are they located? Do they sign a BAA, business associate agreement? Do they sign an NDA? Do they sign all of this stuff? Um, and are they trained, right? So are they trained in virtual receptionists? Who are they working with before? What area, what practice, what types? And so companies like this can provide virtual receptionists, billers, coders, second level, even social media managers, scribes, and they can integrate within your current US based team. So instead of trying to add 15 people in the US, maybe you add 3 or 4 here, maybe you add 3 or 4 in the US, and then you use the AI for the next. Um, the other thing we mentioned, obviously, you want someone who's HIPAA compliant, you want role-based access, and you want global background checks, VPN enforcement, access logging, make sure the people are working. I know we've all had problems with staff when they're remote. Maybe they only work 30 minutes, an hour, 2 hours. But you got to make sure that, the agency is working with you on that to make sure that the people are working, where it's like 30, 40, 45 hours a week on that. Okay, so I'm gonna skip this. I know we have a few questions. So future proofing your operations, leadership strategy, so AI readiness assessment. What a lot of companies can do is, free of charge, they could be like, hey, look, can you come in? This is what we're doing now. Can you, almost like a consultant, can you make recommendations? Where do you think AI companies can help us? Where do you think remote staffing can help us? I think, a lot of it's a feedback loop, right? You go to them, you're like, this is where we have. Um, issue is how can you help us, right? And so if there's like, okay, the whole solution is AI or the whole solution is remote employee or the whole solution is to start company, you probably want to look at that a little skeptically and see where you think the solution is, but also let them evaluate your company and provide them solutions on that. Um, so I think we got a couple more slides, so we'll go through those real quick. Ethical safeguards. I think we're all a little bit cautious about AI and technology in general, especially with HIPAA compliance. Um, so I think a few things you want to make sure when you're working with these companies is where's the data set, right? So the data set's where it's trained on. If your data set's um, based in a certain region of a certain state and you're in New York City, it's just not going to work, right? If your data set's in like Kansas or Oklahoma or something, or if you're in Oklahoma or Kansas and your data set's in New York City, that might not work for you either, right? So you want to see how they're trained and how they're going to train within your organization. The next point I really want to talk about is transparency and trust. So staff, patients should know when AI is used, what it's doing, how decisions are established, how they're made. If you're using AI for scribing and you're not telling the patient, patients are going to get pretty upset when they have that. So we want to make sure that they do that. Audit trail. So you always want to make sure that everything's auditable. So if the AI is coding and billing, you want to know why it's coding a 99214 or 99213. Why is it coding that instead of the other one? So you want the AI to explain itself. You want to be able to go through the node and try to fix that. Confidence scores, low, medium, and high confidence. We always want to make sure of that. And then regulation to some extent is coming. And I think we've seen with the internet, it'll probably be here eventually, but is it going to be here the next year, 2 years, 3 years? Probably not. So you want to make sure that the company you're working with has best practices. Both for themselves, but also to the level of your company that you feel comfortable with them. All right, so key takeaways. Real quick before we jump on to the question and answer. AI is best for tasks that support the care team. If you're expecting AI to take over the whole process, work with patients, it's probably not going to work, right? Secondly, balance is not optional, strategic. So that balance might not be 50-50 for you. Maybe it's 10 or 20 or 25% AI, 75% or 90% human. But you got to find out what's right for your practice. And probably the most important of any of these is empathy, oversight, and planning are key. If your patients don't feel heard, if they don't feel that you're listening to them, it's just not going to work. And if you don't have the planning over the next 6 months, 12 months, 18 months, by the time you do it, your competitors are going to get a head start on you, and they're probably going to take a lot of the business, patients, what have you, before you're able to. And finally, AI, it won't take your job. but someone who knows how to use it, it might take your job, especially if you're not able to implement this in your practice. So great. This is a slide, and this is our website. We've gone over it, but do we have any questions that we can address? Sorry, I know there's a lot of information, went through it really fast. That was only 10 slides. I thought we'd be done in like 30 minutes, but took a little bit longer, so that's good.
Yeah, Rian and Umer, that was fantastic. Thank you so much. We do have quite a few questions in about 10 minutes or so, so we'll get to those right now. Let's see. John's got a question here in the Q&A. What technology is used for remote billing specialists? They dial into the EMR or PM via their home internet service provider via VPN or other. He's really getting at the point of how is privacy and security? How do you ensure there are no breaches there?
Yeah, so I think on that one, you want to see what protections the different companies have. Are they willing to sign a business associate agreement? Are they willing to take responsibility? So we've seen companies where they're based in India and they make that person in India who makes $200, $300 a month, they make them sign the business associate agreement. Who are you going to go sue? They're like, we're not taking responsibility. Go sue that guy in India. That's not going to work, right? You also got to make sure that they have really secure VPN services. You want to make sure that they, whether they go to the office or what have you, there's no printing capabilities, all that stuff. And then you want to see if, they have SOC 2 security, all that stuff. The other thing you got to make sure certain EHRs, like Epic, for example, they don't let you have remote employees in all these different countries. So you got to actually be certified by Epic. So we have Edge has employees in Pakistan, Costa Rica, Peru, as well as the U.S. Costa Rica and Pakistan are approved by Epic. Peru is not, right? And so you gotta make sure those things are all there. But really, you want to talk to, have your security team, or if you're familiar with it, have them talk you through like what are all the different points on those.
Okay. Next question. Please provide a bit more insight into how the AI works with coding for physician services provided, and what is that AI secret sauce to reduce days outstanding in AR to such a large extent? Thank you.
Yeah, so definitely, I think on that one, there's no real secret sauce, right? It's hard work. It's a lot of integration. You want to make sure that the team has a good tech team, right? So AI can do the coding right away, right? It doesn't take long. It takes a few minutes, few seconds. Uh, but you want to make sure that the AI billing and coding team that they use reasonable standards, right? Somebody can come in there and they're like, oh, we're able to get 90%, right? We actually talked to companies in like India, Pakistan, Philippines, even in the US, where they're like, oh man, we're able to have AI code 90%. We go on their website, we try to hire some of their engineers, and they're like, oh man, it's all manual. We don't actually have an AI team. I think you've kind of seen all that, right? So you want to make sure they go through a trial run. They make sure, they give you real world examples, live examples to do that. And I think, kind of mentioned somewhere in the presentation where the AI, ideally you want to get an AI program that's able to integrate with your EHR. So I know someone mentioned Valiant on there. And so, whether it's eClinicalWorks, Epic, whatever it is, that they're able to integrate with them, and that they're able to pull the note, that they're able to code the note and then submit it. So there are a lot of them where you can't actually, they won't integrate with the EHR, but they'll let you copy and paste a note into another place. And that still takes time, right? So if you're trying to do 100, 200 notes a day, um, that can still be challenging. But if it's all integrated, if it's all doing it in real time, that's a lot easier. And I think that's kind of what you need. And I think the coding is important. A lot of doctors do their own coding, but the billing and the submissions is even more important, where you're getting 10 or 15, 20 different data sets or data points, and you're just copying and pasting it over there. There's a large chance to make mistakes on those. So you really want to make sure that the EHR is integrated as much as possible. Not always possible, especially for some of these smaller EHRs. It's very cost prohibitive sometimes. So you just want to see what works for you guys.
Okay. So we've got time for a few more questions. So if anybody does have a question, drop them into that Q&A section. You'll see that Q&A button down at the bottom of your screen. Next question that's in, is it possible, or perhaps does it already exist, for AI to interpret lab results and provide a summary of next steps to the physician?
Yeah, so there are software that's able to do that. Some of it's like early stage,
Mhm.
some is like a little bit more advanced, but really it's so a lot of these softwares they'll be trained on maybe a data set of like 2.5 million nodes, right? But some of them are really good, some are not so good. And so the LLM or the agent is only as good as your data set and the data set that they use. So the longer they'll be with you, the more they can see how your doctors have responded. They'll take the old data, and they'll be able to summarize uh, the lab results. But the really good ones will be able to pull back the notes from the last 6, 12, 18 months and compare it to other patients who have had similar conditions. And this is how the doctor wants to respond to them. So definitely possible. It's still in the early stages. If you want something that's like foolproof, probably not there, but it's enough to give a summary to the doctor, alert the front office staff to call the patient, schedule them, and bring them in at that point.
Okay. We've got a couple of minutes left, so I wanted to give each of you an opportunity. If you want to leave our audience with anything here, a final thought or anything where they can utilize AI in the best way possible in their practices.
Yeah, definitely. I think as Umar mentioned at the very beginning, as our slides mentioned, and we mentioned, AI is not a cure-all. It's not going to fix a bad practice management. It's not going to fix chronic understaffing. But it will. What it will do is take a lot of the mundane road tasks, do those, and then give your practice time and your practice members time to work with the patients, work with the doctors, work with the care team, and really improve care, and make it more efficient. And I think if you look at it that way, as it's a complementary product rather than something that's going to fix all your ills, that's probably the best way to do it now. Whether in 2 years, 4 years, 5 years, it's able to take on more tasks. It probably will, but at this point, and over the short term, it's really a supplementation to what you guys are doing. And it's really important to find the right trusted vendors. A lot of people under promise, no one under promises, right? Everyone over promises. You just want to make sure that you know what the timelines are, what they're going to give you, so that you can have your human team work with that, and so you can plan over the next 3, 6, 12, 24 months to really optimize everything.
Okay. We did have a question just come in, so I do want to get to that. And I also wanted for people listening who can't see the chat, for learn more about Renova.ai. That's it. That's the website where you'd go there to learn more about them. Renova, RINOVA.ai. And here's our last question we'll leave people with. The EMR at our clinic, it uses Valant, VALANT. So they're having some issues there. Do you know of any AI that can be used with Valant to streamline billing?
Yeah, definitely. So I think if you guys have questions with that, just contact us. We can help you. So all the different EHRs, they all use the same standard. It's a fire standard FHR, and you just want to make sure that whatever company you're using is able to integrate with that, which everyone should be. It does take a little bit of time, so you got to request access from Valent, and then they'll send the practice a request to approve it. Then they'll give you sandbox access, API access, and then the billing team or the technology team of the billing company or the AI company, they'll work with you to create an agent that will streamline that. So that is a process. Usually, the slowest part is is the EHR, and then once you get that, the integration, you can get that in, a few weeks usually. Um, but it is a process. So yeah, if you have any questions, you guys can always reach out. We do work with all the different EHRs. And I think, if you have anyone who has a good tech team should be able to work with all the different EHRs, and it'll take some time. So
Perfect. Perfect. Thank you so much. We are at time. So Rian, Umar, thank you so much. And I want to thank everybody who was in attendance today, helping drive this conversation and for y'all's presence here. Thank you so much. The education for this session is now ended. We would like to thank Edge for their sponsorship. Visit their website at ownedge.co to learn how they're combining remote work with the operational efficiency of AI to deliver front and back office support for healthcare practices, which helps teams work smarter, scale faster, and focus more time on patient care. If you do have content questions, please direct those to Umar at Umar, that's UMER.TAHIR at ownedge.co. If you have a webinar related question, contact ed@mgma.com. And be sure to complete the evaluation, which will be available in the learning management system 5 to 10 minutes after we sign off. After earning your certificate of completion, which is required to claim credit, please allow 24 hours for system communications. For information on all of our conferences and webinars, please see the MGMA events page. Thank you, everyone, and see you at another online event soon.